Hello, and welcome to Introduction to the Light Microscope. My name is Jennifer Coyes, and I will be guiding you through the first part of this presentation. Then Dr. Lisa Marinelli will take over for part 2. We would first like to thank Dr. Stephen Capon for contributing numerous slides and images for this presentation. The objectives of this course are to learn the key components of a microscope, to understand how to set up the microscope for optimal slide viewing, and to review common microscope troubleshooting tips and tricks. When you first sit at the microscope, you'll want to ensure you are in a good neutral position. Take care to ensure your head and neck are well aligned with your spine. You may need to adjust the eye tube length, height, or angle to ensure that the neck is tilted less than 20 degrees. Adjust the chair height and table height so that the knees are at a 90-degree angle and feet are touching the floor, and your arms are at a comfortable 90 to 120 degrees and can easily reach the adjustment knobs. Next, you will want to adjust the eyepiece interpupillary distance by rotating the base of each eye tube so that the left and right fields form one light circle when looking through the scope. You can reduce eye strain by making diopter adjustments to compensate for differences in vision between eyes. Start by opening the eye that corresponds to the eyepiece without the diopter adjustment ring. So for the microscope pictured here, you would start with the left eye since the diopter adjustment ring is on the right. Keep the right eye closed and look through the microscope with the left eye. Focus the slide image at 10x using the coarse and fine adjustment knobs. Once in good focus, close the left eye and open the right eye, and then turn the diopter adjustment ring to focus the image. Now, with both eyes open, the image should be in good focus. Now that you are set up for success, we will transition to discuss the microscope parts and how they are used. You will find the main power switch located on the frame of the microscope towards the back. It may be on the left or the right side. Be mindful to turn the scope off after each use to preserve the life of the lamps. The Allen screwdriver is needed for microscope assembly, disassembly, and when the screws become loose. This is stored either at a compartment at the top of the frame or in a hanger behind the scope. The slide holder is most useful for examinations that require high power and fine movements. It is secured with 2 screws towards the back of the stage. Once the slide holder is in place, you can use the X and Y axis knobs to move the slide smoothly. For examinations that do not require fine movement, the slide holder can be removed and the slide can be manipulated with your hands. Just be sure to screw the slide holder screws back into the stage for storage so that they don't get lost. Every microscope has a brightness adjustment knob so that you can set the light at a level that is most comfortable for you. This knob is typically located at the base near the front of the scope. The light intensity preset switch allows you to automatically set the light to a preferred intensity level. When this is in the on position, there will be no change in brightness if you try to use the brightness adjustment knob. To adjust or set the light intensity preset level, you will need to use the Allen screwdriver in this hole. However, some newer scopes have a set button near the brightness adjustment knob. The microscope condenser sits centrally just below the stage. The condenser switch is typically located on the left side of the scope just beneath the stage. When you are viewing slides at 2x, you will want to flip the condenser out of the way to expand your field of view. When viewing slides at 4x or higher, you will want to flip the condenser into place to focus the light for a higher image quality. When the condenser switch is in the vertical position, the condenser is in place. You can also peek through the hole in the center of the stage to see the condenser move as you flip the condenser switch. This picture demonstrates the utility of the condenser. The top windows show the slide at low magnification using the 2x objective. As you can see, use of the condenser with this low power greatly limits the field of view, so you will want to remove the condenser to expand the field. In the bottom windows, we see the slide at high magnification. Without the condenser, the image quality is grainy and fine features are difficult to appreciate. With the condenser in place, we get a far superior image quality. The condenser height adjustment knob adjusts the height of the condenser and is located just beneath the condenser switch. This is used during the Kohler illumination procedure. The condenser centering screws, which are also needed during Kohler illumination, are stored just behind the objectives. They screw into small holes at the base of the condenser. Here you can see one of the small holes, and the other hole is located on the opposite side. The field iris diaphragm ring is typically located on the lower right side of the scope base. This controls the area of light reaching the specimen, which defines the field of view. It's primarily used during the Kohler illumination procedure, which you will be learning later in this presentation. Just above the nosepiece, there is a slider insertion slot. This is needed when using analyzers with special optical elements such as a polarizer. The scope will typically have a daylight blue filter in place, but it can be removed using the filter slider when other filters such as a polarizing filter are needed. You will be learning how to polarize later in this presentation. The aperture iris diaphragm ring sits at the front of the scope just below the stage. It controls the amount of light reaching the specimen, which determines the resolution, contrast, and depth of field. When this diaphragm is closed, there is better contrast and depth of field, but you will lose resolution and brightness. When it is completely open, the opposite occurs. 0.7 is a common setting that works well for most purposes. Finally, the coarse adjustment tension adjustment ring sits just behind the coarse adjustment knob and allows you to adjust the tension of the knob. Now that you know the main components of the microscope, I will pass things off to Lisa for part 2 of this presentation.
Thank you, Jen, for that review of proper posture and the components of a microscope. I'm Lisa Marinelli, and I will be discussing Kohler illumination, taking measurements, use of a polarizer, and some common troubleshooting issues. And we'll start with discussing Kohler illumination. This is a method that provides even illumination of samples and prevents glare, ensuring that you don't have an image of the illumination source in your field of view. Now, there are multiple different optical components between the light source and your retina, which are depicted in this image. And as light rays traverse the components, they are focused in different image planes such that an image of the specimen is perfectly in focus at different points in the path, and an image of the light source is perfectly in focus at different points along the path. And we achieve Kohler illumination by arranging the optical components such that we perfectly defocus the image from the light source at the point of your retina, which you can see with these dispersed red rays. And we perfectly focus the image of the specimen at the point of the retina, which we can see with these focused blue rays. And so the first step of establishing Kohler illumination is to focus your specimen. Next, you close down the diaphragm, which should bring a dark-rimmed octagon into view. Continue to rotate the aperture until the octagon occupies 2/3 of the field of view. Next, we want to focus the condenser to make the edges of the octagon as crisp as possible, and you can do this with the condenser height adjustment knob. Then center the condenser using the 2 condenser centering screws to bring the octagon centrally into your field of view. And now open the field aperture until the dark octagon is just beyond the field of view. And lastly, you can adjust the aperture iris diaphragm ring to optimize the contrast of the image. As we mentioned earlier, 0.7 is a good setting for most purposes. Shifting topics here, we'll discuss how to take measurements using an ocular micrometer. This is not quite as easy as it is on digitally scanned slides, but with a little practice can become fairly straightforward. An ocular micrometer is an engraved ruler present in one of the ocular lenses. And in order to accurately use this ruler, we have to determine the distance represented by its tick marks. And this will vary depending on the objective used, and so calibration has to be done at each objective with which you intend to use the micrometer. In my experience, most pathologists calibrate their micrometer for use with the 10x objective, which they use to make their measurements. And so we calibrate the ocular micrometer with a stage micrometer, which is a small engraved ruler on a glass slide, for which there's a constant distance between tick marks, regardless of the magnification used. And so in order to do this, you need to first focus on the slide containing the stage micrometer. You can see on the right here what the stage micrometer and ocular micrometer would look like. Now you rotate your ocular lens and or move the stage micrometer so that the ocular micrometer is superimposed on the stage micrometer. And move the stage micrometer so that the first tick mark lines up exactly where the ocular first tick mark is, as you can see in this bottom image. And then with the micrometer superimposed, you find a point where the stage and ocular micrometers have a tick mark at the exact same location. Then you identify the number of tick marks between the first tick mark and their overlapping tick marks. And you can use this simple equation to identify the distance in one of the tick marks in your ocular micrometer. And from there, whenever at that objective lens, you can use this known tick mark distance to take measurements. The ability to use a polarizer is another important skill in dermatopathology that is most useful for assessing Congo red stains for amyloid and in looking for foreign bodies, many of which are polarizable. And to do this, you want to first replace the filter slider, which is number 1 in the diagram on the right, with your polarizer. Then you can insert the analyzer and dummy slider into the slider insertion slot in your microscope. And with the area of interest in focus, you then rotate the polarizer lever slightly until the field becomes its darkest. This indicates that your light is crossed, meaning the polarization plane of your polarizer is perpendicular with the plane of your analyzer, and thus no light is able to pass through. You may now examine your specimen under polarized light. Now, there are a lot of different reasons why things can be a bit off or not functioning quite right when you go to use a microscope. And I'll share just a few of the common issues, and this may serve as a good reference for you to run through in the future if you run into difficulties with a microscope. One common issue is when the image in your scope is extremely bright, but when you try to rotate the brightness adjustment knob, this doesn't appear to change the brightness. Most likely this is because the light intensity preset switch is on, which will maintain a certain light intensity regardless of the settings of the brightness adjustment knob. So you can just press this to turn it off. Another issue you might face is your specimen appearing grainy and not quite in focus when you're at the 4x objective or higher. The image might look like what you see on the bottom right-hand side here. And this is because the condenser is not in place to focus the light. And it's easy to forget when flipping back and forth between objectives, but when using a 4x or higher objective, the condenser should be flipped into place for optimum image quality. On the other hand, you may find in some situations that you have a round circle in your field of view that limits your view when at 2x, as in this image on the left. And this would happen if you forgot to flip the condenser out to expand your field of view when using the 2x objective. Now, if you ever notice this circle in your field of view when you're not at 2x, so at 4x or higher, and the dark circle has slightly polygonal borders, as in this image on the right, this is just an indication that the diaphragm needs to be rotated slightly to expand the diaphragm to your field of view. And then lastly, if you ever find yourself facing a lot of resistance when trying to turn your coarse adjustment knob, you can resolve this by simply rotating the coarse adjustment tension ring to reduce the tension. And that concludes our instructional video. We hope that you have found it useful. The best way to solidify some of these skills is through hands-on practice. So we encourage you to take some time to practice some of the skills that we've reviewed today.